Hello and welcome to our next discussion from your Harrisburg Area Community College Blended Learning EMR program. James Weber here to give you a little bit of a rundown on the topic relating to lifting and moving. So let's kind of work through it. First, as an EMR, you have an obligation to analyze the emergency situation and to quickly evaluate the patient's condition to carry out effective life-saving procedures. And those procedures may include lifting, moving, and positioning a patient, right? Sometimes you're in a position where you got to move somebody, and it's important we have an idea as to how that's done. Every time you move a patient, keep some general guidance in mind. Our goal, always, do no further harm to the patient, right? Move the patient only when absolutely necessary. Move the patient as few times as possible. Move them as a unit. Use proper lifting and moving techniques, and only have one rescuer giving commands. Also consider some general recommendations. Delay moving the patient if possible until additional EMS personnel arrive, right? Treat the patient before moving him or her to a place that's different, right? The only time that we want to move a patient first is when they are unsafe. Don't step over the patient, and explain to the patient what you're doing. Keep in mind the rules of good body mechanics. Know your physical limitations, right? Know your physical limitations. Keep yourself balanced. Maintain a firm footing. Lift and lower the patient by bending your legs and not your back, right? We have an awful lot of EMS providers, bad backs, bad shoulders. Why? Because we're not using good techniques. Lift and bend with your legs and not your back. And try to keep your arms as close to the body as possible to improve your strength and balance. And of course, move the patient as few times as possible to accomplish those tasks. Recovery position. This is a pretty important position. If there was any other position out there that was quite as important, I tell you, but this is probably the most important position that we can move a patient to, right? Any unconscious patient that hasn't suffered trauma should be placed in this position. This will make sure the patient's airway remains open and allows any secretions, vomitus to actually drain from their mouth. It's really important that we get the recovery position correct. Body mechanics and proper lifting or moving technique can result in injury to you or the patient. Good body mechanics make a difference, right? Use the strength of your large muscles in your legs to lift patients instead of using your back muscles. Pretty important. Good body mechanics require you to keep your back straight as you lift, to lift without twisting your body, to ensure you have firm footing before you start to lift or move a patient, to assess the weight of the patient and to know your physical limitations. Also, good body mechanics require you to call for additional personnel if it's needed, to communicate with other members of the lifting team, and to practice lifts and moves accordingly. To move a patient immediately in the following situations. Things like danger of fire, explosion, or structural collapse exist. Hazardous materials are present. The emergency scene cannot be protected. It is otherwise impossible to gain access to other patients who need life-saving care. So it's important that we know how to move these people in these circumstances. As well as any patient who experiences a cardiac arrest, right? We've got to move a patient into a good place so that they have the ability to do things like CPR. Clothing drag, of course, is the simplest way to move a patient. Grasp a patient's clothing in the neck and the shoulder area, rest your patient's head in your arms, and drag them out of danger. And this picture is a good example of a way to approach that. Cardiac patients and the clothes drag, right? If you're in a room where a patient's not large enough, you need to move the patient, drag a patient from that tight space and move the furniture out of the way, like we said before, to create that space so that you can start CPR. Blanket drag, of course, if they're not dressed or not dressed in reasonable clothing that would avoid tearing, of course, we could consider a blanket drag, right? Place the rug on the floor and roll the patient onto it and just drag them to safety. It does work. We could certainly consider it. Also, that arm-to-arm drag is a way to move patients as well, and it's going to be, and the way to go about it is to place your hands under the patient's armpits from the back and grasp the patient's forearms. It's generally used to move a very heavy patient, and it offers some protection to the head and neck. All of these, of course, are things that we're going to practice during our lab sessions. The firefighter drag, tie the patient's wrists together, get down on your hands and knees, straddle the patient, and of course, pass the patient's knees or hands around your neck, straighten your arms, and drag the patient across the floor. This is a supine method of actually doing a firefighter drag. Emergency drag from a rescuer, right? Grasp the patient under the arms, cradle the head between your arms, and of course, pull the patient in a horizontal position as you ease him or her from the vehicle. These are only done when a patient is in a life-threatening situation, but it's important to know how to do it. This is just an example of that emergency drag out of a vehicle, right? Just a way to approach getting the patient safely from the vehicle. Emergency drag from a vehicle, two or more rescuers, right? One rescuer supports the patient's head, the other one removes the patient with the neck stabilized in that neutral position. Of course, use a backboard if you can, but ideally in these emergency drags, you're only doing it in environments where you don't necessarily have time to drag the person from that vehicle. Wheeled ambulance stretchers, it's one of the most commonly used EMS devices. It can be raised, it can be lowered, and it can be loaded into ambulances. And this is how our patients will be moved from place to place. They have belts to secure the patient, and it is part of our obligation to make sure, as emergency medical responders, we're clear to how to use these, because you may very well be called upon to help lift and lower the patient on that stretcher and help get them loaded into that ambulance successfully. Stretchers can be rolled or carried by one or four people. If a surface is smooth, just roll it. If the loaded stretcher must be carried because the surface isn't smooth, it's best to use four people, one in each corner, so we don't tilt the patient off the stretcher. If the stretcher must be carried through a narrow area, unfortunately only two people will fit. Just be very careful when you use these wheeled ambulance stretchers for that very reason. Portable stretchers, of course, used when the wheeled stretcher cannot be moved into a super small space. They're lighter, they're smaller than a wheeled stretcher, and can be carried the exact same way a wheeled stretcher is carried. It just requires the carrying of two providers and not necessarily the use of those wheels to help facilitate movement. Stair chairs is another item in which you might be called to use. This is a super old one. Some of the newer ones definitely have a little bit of a better leverage. They've also got tracks to help you get them up and down stairs. But the goal is to use this chair to help carry a patient downstairs. It's a portable moving device. It's useful for patients who are shortness of breath and more comfortable sitting. They're lightweight, easy to carry. We just don't want to use them for patients who have experienced any trauma, right? We should be using a backboard and a cervical collar, ideally for those tasks. And we'll talk more about that here shortly. A mobilization device is good. These are used to immobilize patients who have back and neck injuries. They're used to assist in lifting and mobilizing patients with lower extremity injuries. Long backboards are generally used for moving patients who've experienced trauma and useful for lifting and moving patients in small places. Long backboards made of plastic or fiberglass. Patients must be secured with straps. If the patient has a sustained back or neck injury, then the head should be immobilized. Short backboard devices, these are called Kendrick immobilization devices. They're pretty common in EMS systems. They're used to immobilize the head and the spine of patients found in a sitting position. They're generally made of plastic. They have lots of straps, and they're used as a vest-like garment that wraps around the patient. Scoop stretchers, helpful when moving patients out of small spaces. Do not use for patients with head or spinal injuries. And we'll talk a bit about how to use the scoop stretcher during one of your lab sessions in the program. For emergency situations, use wide, sturdy planks. If you don't have access to EMS equipment, use doors, ironing boards, sturdy folding tables, full-length lawn chair, recliners, surfboards, and snowboards. I mean, there's lots of different things you could use to actually immobilize a patient if you're not left with all the equipment you need to be successful. That's part of that innovative discussion we had in Chapter 1. Treatment of patients with a suspected head or spinal injury. Anytime a patient has sustained a traumatic injury or a suspected injury to the head, neck, or spine, any improper treatment can really affect a patient long term. Improper treatment can lead to permanent damage or paralysis. It's important that we keep the patient's head and neck in a neutral position and immobilized whenever it's possible. Applying a cervical collar, right? Cervical collar is what's going to prevent any excess movement from the head or the neck. Those soft cervical collars don't work. They don't provide sufficient enough supports. We need those rigid cervical collars that are made of plastic that are really going to be what's mostly successful at protecting your patient's cervical spine. Cervical collar should be applied before the patient's placed on a backboard, right? When we apply it, it should be measured appropriately, and I'm going to put a video on D2L of how to do a proper measurement, okay? But we are going to add that to D2L, so keep an eye out for it. Movement of a patient using backboards. Patients should be transported on a backboard, include anybody who's had sustained spinal trauma in a motor vehicle crash or a fall, any patient who's sustained gun wounds to the trunk, to the torso, to the, not the arms, not the legs, not the head, but that trunk space as well as the head to some extent, but definitely not the extremities. Those are people who should really be considered transported on a backboard, right? If you suspect the patient has a spinal injury, move the patient as a unit, right? Transport the patient face up. That's pretty important, right? Face down, easy way to close off a patient's airway. Keep the patient's head and neck in a neutral position. Be sure that all rescuers understand what is to be done before attending any movement, and of course, whenever you move a patient, regardless of the method, it's important that only one rescuer gives verbal commands. Straps and strapping techniques. Every single patient who's on a backboard should be strapped down using preventative sliding or slipping techniques, right? The strap should be long enough to go around the board for a large patient. Straps 6 to 9 feet long with seatbelt style strap buckles actually work really well for this. Once the patient's centered on the board, secure the upper torso with the straps, secure the pelvis and the legs using padding in whatever void spaces we can. Head immobilization. The blanket roll is an improvised device that works well, right? Fold and roll the blanket. We're going to go over some of these skills and how to create a blanket roll to assist with those head immobilizations as well. It's going to be part of some of the skills we're going to work on during the program. Anyway, head stabilization. It must be maintained throughout the entire procedure, right? The blanket roll must be fitted directly against the patient's shoulders and head. It should secure the blanket roll to the head with 2 cravats tied around the blanket roll, and you'll see some of these skills demonstrated during your lab sessions. Use 2 or more cravats to bind the head and the blanket roll to the backboard itself. Foam blocks are ideal. They're really made to secure to the head rather than those blanket rolls, and they work really well to make sure we provide good stabilization of the head and neck during backboarding. Just a couple of things we want to go over just to kind of highlight the key parts of this chapter, right? Biggest general guidelines. Do no harm. Move the patient only when you absolutely have to. To move the patient as little as possible. That's important too, because when we move the patient as little as possible, we limit the amount of potential spinal trauma that we can make worse during that movement. To move the patient's body as a unit, to use proper lifting and moving techniques, that's for us. We don't want to mess our backs up, right? And have one rescuer give commands when moving a patient. Unconscious patients who have not sustained trauma should be placed in the recovery position. If a patient is on the floor or on the ground during an emergency situation, we might have to drag a person away from the scene instead of trying to lift and carry that person. So it's pretty darn important that we're aware of that scene and how quickly we need to move that person, right? Do not lift or move the patient when you suspect a spinal injury unless it's absolutely necessary. EMS services typically used wheeled ambulance stretchers and portable stretchers to move patients. Be aware of that equipment. You'll be able to see it during class. And a cervical collar prevents excessive movement of the head and neck. Log rolling is the primary technique used to move a patient onto a backboard once the patient's been secured to the backboard and the head and neck must be immobilized. This is just kind of a little bit of an overview on your Chapter 3 discussion for your EMR program. Should you have any questions, comments, concerns, do me a favor, roll over and reach out to your program coordinator. And we appreciate your time. We appreciate your patience, your energy, and your hard work in the program thus far. And we look forward to seeing you in our next discussion. Have a great day.